So the next question I probably will pose to both Doctors Cooper and Dr. Roto. We have a lot of EGFR questions, but some of these are nuanced and pertaining to the type of therapy. And so the first one, I guess, for Dr. Cooper and Dr. Roto can chime in as well, if inclined, is how efficacious immunotherapies, TILs, CAR Ts, personalized vaccines, et cetera, are for EGFR mutant lung cancer and in solid tumors altogether, I guess. And is there work being done in that, not in solid tumors, but lung cancer, wild-type lung cancer altogether? And is there work being done in that front?
Yeah, I can start. And definitely, please, Dr. Orto, jump in because this is definitely your area. The traditional teaching is that immunotherapy is not that efficacious in patients with EGFR mutant lung cancer. And the reason for that is that the EGFR mutation itself seems to sort of impart this very immune suppressive environment where even if the PD-L1 expression, which is the marker on the tumor that tells us how likely is it for the cancer to respond to immunotherapy agents, even if that number is high, we just don't think that there's a lot of effectiveness for giving those agents in the setting of EGFR mutations. So that marker doesn't really mean much in the setting of an EGFR mutation. And indeed, we found that actually, when you give those agents after an EGFR targeted therapy, that's actually a very unsafe combination, and patients can have a lot of dangerous toxicity. For example, lung inflammation, like pneumonitis, is the word that we use. It's a very significant risk factor. So for that reason, we tend to steer clear of using immunotherapy in EGFR mutant lung cancer. Although, I do know sort of one-off or sort of anecdotal cases. I think probably everyone has heard of a handful of cases of patients who maybe way in the later lines of therapy, they've seen a lot of therapy and their doctor has tried immunotherapy and maybe they have had some benefit. But again, it's not on a population level, the traditional teaching. I can throw it to Dr. Roto for more.
Yeah, I absolutely agree. It's I think it's hard for us as a field as well, because of course, immunotherapy has been transformative for a lot of our patients with lung cancer. We see sometimes very long-lasting, durable responses. I think it's very hard for a lot of our young patients with these actionable drivers. They're in a situation where immunotherapy on average is not going to be very effective for them. And I agree that I mostly avoid current available kind of we call checkpoint inhibitor immunotherapies like pembrolizumab or other medicines like that until very late line, if I use it at all for my patients with an EGFR mutation. This is very different cancer, right? We think about kind of classical lung cancer, we think it might be risk of history of tobacco use. This has had a lot of carcinogen exposure. It's a very kind of genetically messy cancer, a lot of mutations, inflammatory environment. The immune system has kind of a fighting chance to respond. But EGFR lung cancer, it's, there's one mutation or just a few mutations, it's a very different tumor and therefore a very different interaction with the immune system. Now, the question asked about other emerging immunotherapy options. So, of course, if current checkpoint inhibitors that we use for a lot of lung cancer aren't working, will emerging novel technologies change this? I think that's currently unknown. It's a bit of a black box. Can we activate the immune system in other ways to produce responses to these, I often call them immunologically cold tumors? And that's, I think, the holy grail in oncology. Can make cold tumors hot or reactive to the immune system. EGFR is a great example of that. I would say right now, this is really early days. I think clinical trials are few and far between right now. And if they're around, they're in very, very early phases of development. We don't yet know clinically what the chances are of activity. So it's a bit like, rolling the dice or, hitting a Hail Mary pass where we don't yet know if these agents will work. But I do think they warrant further study. I think we're all hopeful that one day as immunotherapy technology emerges, our understanding of the immune system emerges, hopefully we'll be able to target these more difficult cancers as well.
And I think very well said by both of you. I also enjoy the sports analogy, Dr. Roto. I did not know you were a sports fan. Well, we'll explore that later.